Robert Velarde works in emergency centers throughout Texas, and he is joining us live tonight with his perspective, medically speaking, on where we're at. Doctor, we appreciate your time. I'd like to begin with what you're seeing right now in your community, in your emergency centers.
So basically, it's an unexpected surge of all the cases of COVID. We're kind of expecting the cases to go up, but not as fast as we're seeing. This is spreading so quickly that it infects the whole family, and it's actually infecting all the vaccinated people as well. We're not seeing only a surge in cases on COVID, but flu as well, and in pediatric populations.
Is it impacting how you treat other patients who are in the hospital?
The problem is that it is spreading so fast and in so many family members at the same time that we have so many people showing up to the ER at the same time, and we're having people waiting longer periods of time, and then lagging some treatments. On top of that, we have a shortage of the monoclonal antibodies, so we have to be really careful on who meets criteria so they can get the proper treatment.
What are you noticing in terms of symptoms with people showing up with either Delta or Omicron?
So Delta was showing up with most gastroenteritis type of presentation, nausea, vomiting, dehydration. This Omicron is presenting more as a mild, but with viral symptoms. Again, we're seeing the nasal congestion, the cough, difficulty breathing, shortness of breath, and of course the fever.
Is it stretching your resources? Are we getting to a point where we saw the lack of ventilators and some of the concerns we had earlier in the pandemic?
It is actually stretching all the resources again. The other day, I had to tell one of my patients that we ran out of the monoclonal antibody. We were able to provide any other treatment, but besides the monoclonal antibody at that time, so we had to transfer the patient so they can actually get the monoclonal antibody.
Are you having to turn anyone away, doctor?
We don't turn anybody away. We stabilize, and we need to transfer to a higher level of care.
How is this impacting your staff right now?
It is impacting really, so that it's more work for everybody, and on top of that, a lot of personnel, even fully vaccinated with booster, they are getting sick, and I had COVID positive staff as well that we had to find replacements.
At this point in the pandemic, I'm curious, are you having any success convincing people to get the vaccine? What are the conversations you're having?
I think once they have a family member that has been infected and they have to suffer through this illness, that's the only way that I find to get to them, because some people, they're just really into not getting a vaccine, and they don't actually understand the importance of stopping this just by getting a vaccine.
There's a lot of debate, as you know, out there about the mandates. We saw Tom's story a moment ago. New York, some other major cities installing mandates, especially for outdoor dining, other activities. Medically speaking, is that something that you support? Would it help?
I strongly support, and I think we would be done with all of this if everybody would be vaccinated.
How about the testing? How does that impact what you're seeing? Does it concern you that there doesn't seem to be enough tests to match demand?
The problem is that we don't know the magnitude of the problem if we don't have enough testing. So we would have more testing sites, and even now close to the holidays, most of the offices that they test, they're closing. Then we're not going to know the real numbers that we're dealing with.
We heard the president today talk about support for communities across the country. Do you feel as though you have the support you need? Has that diminished over the course of the pandemic?
The support is there, but sometimes the supply is not, and because of the shortage of medication, we're having issues.
What are you predicting the start of the year will look like?
We're going back into a surge. We're going back into not having enough beds, and probably collapse of the health system again if people don't understand that they need to get a vaccine. We're running out of beds.
So how are you preparing to handle that?
We're trying to enforce, again, hand washing, teaching the population, teaching families, having family members to talk to everybody and try to get the vaccine and stay away, 6 feet away, wear a mask. And if we can avoid getting into large crowds and going out again, we're going to be able to manage somehow this new surge.
It seems like some dark days ahead, certainly in your community. Dr. Robert Velarde, thanks for what you're doing. We appreciate you coming on tonight for an update.
My pleasure.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.